Good day, I am Aldrin Havaliano and this is CHN Skill Clinic Visit. So by definition, it is healthcare service provided on an ambulatory basis rather than by admission to a hospital or other healthcare facility. The services may be a part of a hospital augmenting its inpatient services or may be provided at a freestanding facility. So there are four purposes. First is to provide basic medical service such as vaccination. Second is to confirm that program methodology is on the right task. Third is to assess healthcare needs are available for the low income, unintended community. And fourth is to increase awareness and prevention of disease through patient education. So for the equipment, all you need is the family record and a first aid kit. So there are four phases of this procedure. First is the registration or admission. Second is the waiting time. Third is triaging. And fourth is the clinical evaluation. So for the registration or admission, first you must greet the client upon entry and establish rapport. This is to gain the client's confidence and trust. So for example, good morning ma'am, I am Aldrin Havaliano and I am a student nurse from MSU IIT. Then, prepare either the family record of new patients or retrieve the records of the old patient because this serves as the baseline data or reference for the future needs of our client or the patient. Then third, elicit the chief complaints of the client and also the clinical history. This is to know the client's health concerns. And then fourth, perform physical examination on the client and record accordingly because findings obtained from the physical examination can be used to better understand the patient's current condition. So for the waiting time, first give priority numbers to the clients. This is to prioritize the patients or the clients who came first. And then implement the first come, first served policy except for emergency or urgent cases. This is to avoid the cutting of lines and also to give immediate care to the patient who is in need of urgent care. And for the triaging, first manage program-based cases which prioritizes the patient-based care. And then second, refer all non-program based cases to the physician. And then all the other cases which has no potential danger, the treatment or the management can be initiated by the nurse and he or she gets to decide to do his or her own nursing diagnosis and then refer to the physician for medical management because severity conditioning must be seen by a physician immediately to avoid further complications or damage. Then, provide first aid treatment to emergency cases and refer when necessary to the next level of care for continuity of care and prevention of complication of the condition. So for the clinical evaluation, first validate the clinical history and physical examination to assure that the data obtained is accurate. Second, the nurse arrives at the evidence-based diagnosis and provides rational treatment based on DOH plan or programs rather. So what he or she needs to do is first identify the patient's program to assure accurate nursing diagnosis to be given. Then second, formulate or write the nursing diagnosis and validate to ensure that the care or diagnosis implemented is accurate and according to the patient's needs. Then third, give or perform the nursing diagnosis, interventions rather. And then evaluate the intervention if it has enabled the patient to achieve the desired outcome for assurance of the proper delivery of care. And then discuss important and applicable home care interventions and the need for follow-up visits as necessary for the continuity of care. And lastly, coordinate referral to the next level of care, such as hospitals, laboratories, city health offices, and the likes, as necessary based on the needs and the case of the patient, so that the patient will receive the care that he or she needs.